All right, let's talk about India's new game plan in its very long fight against leprosy, one of the oldest diseases known to humankind. A major new national strategy is being rolled out, and it has a really powerful goal. So let's dive into what this is all about.
Right from the get-go, the guiding principle here is crystal clear. This phrase, ending stigma, embracing dignity, it comes straight from India's health ministry. And it tells you that this isn't just a public health campaign. No, it's a mission for social change and for human dignity.
So, what is the core mission? Well, it's nothing short of the complete eradication of leprosy. And the deadline they've set for themselves, it's incredibly ambitious.
The goal is to completely stop the transmission of leprosy in the country by 2027. Now think about that. This is a big deal because it puts India's target a full 3 years ahead of the Global Sustainable Development Goal. That's a really bold statement of intent.
Okay, so how are they planning to pull this off? Well, the whole thing was kicked off by a new government directive that signals a really big shift in the country's entire approach to treatment.
And here it is. This is the actual directive that started it all, issued back in January 2024. This piece of paper officially lays out the new rules, the revised classifications and treatments. It's basically the memos sent to health departments across the country saying, okay team, the strategy has changed.
At the very heart of this new strategy is one single crucial update. The government is beefing up the treatment for the milder form of the disease. They're moving from a 2-drug therapy to a much more robust 3-drug therapy for what's called parsibacillary or PB leprosy.
So let's break down what these changes actually mean. To really get why the new treatment is a big deal, we first have to understand how leprosy is classified in the first place.
You see, this whole directive is built on the difference between the two main types of the disease, and understanding that distinction is absolutely key to understanding the new plan.
So you've got pausibacillary, we'll call it PB, and multibacillary, or MB. Think of PB as the less severe form. Someone with PB leprosy will have between 1 and 5 skin lesions, but crucially no nerve involvement. On the other hand, MB is more severe. We're talking more than 5 lesions, and this is the important part, the involvement of 1 or more nerves. This difference is what determines the whole course of treatment.
This official table from the new directive lays it all out really clearly. You can see the clinical markers we just talked about, the number of skin lesions and whether nerves are involved. But it also adds a third, definitive test, something called a slit skin smear. This is a lab test that actually looks for the bacteria that causes leprosy. For PB cases, it comes back negative. For MB cases, it's positive. Simple as that.
And that brings us back to the big shift. Before this, the milder PB form got a 2-drug treatment. But now, based on the latest science, the new standard for all PB cases is a more aggressive 3-drug regimen. It basically brings the treatment for the milder form up to the same level as the more severe MB form.
Let's look at what this new treatment actually involves. For both adults and kids, it's a 6-month course. They'll take dapsone every day and then get a monthly dose of 2 other drugs, clofazimine and rifampicin. The addition of clofazimine here is the real game changer. That's what creates this powerful 3-drug combination for all PB cases.
So that's the new strategy on paper. But how do you take a plan like this and actually make it happen on the ground? How does this get India to its 2027 goal?
Well, there's a very clear timeline. The directive went out in January 2024. All the states and territories have until April 2025 to get ready to get their supply chains in order and requisition all the new drug combinations. Then, on April 1st, 2025, the new 3-drug regimen officially rolls out across the entire country. And that's what kicks off the final push toward that 2027 goal of stopping transmission for good.
So you might be wondering, why make this change? Why does it matter so much? It really comes down to solid public health logic. A stronger treatment right from the start is much more likely to knock the disease out completely. This helps prevent relapses, which can be really difficult to manage. And, most importantly, it stops the patient from spreading the disease to others, effectively breaking the chain of infection in the community. And you can just feel the determination behind this whole effort. This quote, it's taken straight from that official letter, and it really captures the spirit of the whole thing. The health ministry calls this new treatment a significant step forward, and you can hear the confidence and the collective will behind that statement.
Okay, so let's just quickly recap the most important points here. First, India has set this ambitious 2027 target to stop leprosy transmission. Second, the heart of the new strategy is a stronger 3-drug therapy for the milder PB form of the disease. And finally, this new national plan rolls out everywhere on April 1st, 2025.
Which really leaves us with one final and pretty powerful question. With a clear, science-backed strategy and a definite timeline to put into action, is India now closer than it has ever been to finally ending the transmission of this ancient disease?